This is our second visit. We have had Shockwave, radial shockwave, focus shockwave, ART. We're gonna do some adjustments here. Done about 15 minutes of PT. And then you're gonna add a YouTube video to boot. It's all in a day's work, baby.
Yeah.
Let's go. With the MRI that I picked up on you, and that you brought in, I should say, you have a history of spraining this ankle. Where does that come from? Is it sports, running?
15 years ago, had an accident sled riding.
Sled riding?
Yeah.
That was where you had some significant trauma to the foot itself? A couple ligament tears that are, like, we'll call them historic. They've been there, if you will, right? So do you ever get pain in any of these areas here with your foot, or is it mostly on the back side?
It's the side there and the back.
Side here? Yeah. So you have a little stress response in the bone and the ligament over in this area on the MRI itself. I don't know if you read that, but so it'll be helpful to get a little bit of work done through here too. Have you ever worn a boot?
Do you mean like a cowboy boot, or do you mean like literally a
Well, you know
boot?
what? Now that you bring it up,
Because yes.
you ever been to Stampede in
That's
Calgary
actually my
before?
primary,
His boots?
yeah.
Okay.
But no, I've had the thing where you sleep in it, and then the walking boot thing.
Gotcha. The motor cares. We're gonna start with Shockwave here. I feel like I'm not getting quick response within the next 3-4 weeks. I might do a referral in-house to Caroline. Caroline's our integrative medicine medical provider. She does PRP injections. PRP can be really beneficial for this type of problem without having to use a steroid. And it's basically taking your own blood platelets, you spin them, you take the good stuff out, and where you have small tears like this, it can be healing for that tissue. It can help regenerate that tear, okay? And so can Shockwave, so we're gonna lean into that for a little bit, but you might be a really good candidate for PRP, and we can evaluate that in a month from now, okay? I don't think you need a boot. But you will use one after if you get PRP. That's the only time. Okay. Point your toes down towards me. Cowboy boots, huh?
For years.
For years. You from Baltimore?
I am actually.
Okay. That's like, that will be a first for me. Someone from Baltimore wearing cowboy boots.
All the time.
Point down towards me. I went to San Antonio, Texas. That's about as cowboy as I've gone in the last couple of years. And bring your toes back up. But I want to go to Calgary and go to Stampede again next year.
Oh yeah.
Have you ever been up that way?
No.
That's a really cool area. Good. Point down for me. Good. A little pressure through tib anterior over the mortise joint. I'm working on it's called the ATFL ligament, anterior talofibular ligament. Right in this area here, that's where he's got a little stress response in the MRI. So just ischemic compression, pin and stretch, working through this tissue. This is an ART protocol for it. This will help it feel better and move better. Okay, go ahead and pull your toes back. I want to work adjacent to the Achilles tendon here. Go ahead and push your foot into me. How was PT?
It's good.
Good. All right, and then back up. Point at me. So this is our second visit. We have had Shockwave, radial shockwave, focus shockwave, ART. We're gonna do some adjustments here. Done about 15 minutes of PT. And then you're gonna add a YouTube video to boot. It's all in a day's work, baby.
Yeah.
Let's go. Point down at me. And then come back up. And I should probably stop doing these foot videos because I have like 6 ankle Achilles tendon patients right now. I'm gonna be marketing myself as the foot doctor in Baltimore pretty soon. I'm okay with it. I want to help people. Bring your toes back. Good. And point down. And relax. So, you're not gonna give me any info where the cowboy boots come from?
Just families from Virginia. We've always sort of done it. So
Virginia is like northeast, but it tries to pretend like it's southern.
No.
South of the Mason-Dixon line.
That's
Yeah, I know.
exactly
It's farm country out there. I get it. Man, it's pretty. You go out to near Charlottesville in that area. I love it out there. My sister went to school at UVA, and I was like a senior and then freshman in college, and I would go and visit, and she'd take me out. It was like the best time. I had a Jeep Wrangler. I was driving out there like every other weekend, coming out to visit her and her friends. It was awesome. Good people. You're gonna feel a little release here, okay? Just like that, okay? But a little quicker for me. Good. No pressure in the knee. It's good. Virginia, huh? There it is. Alright. Let's go 2 for 2, man. Let's make this happen. Raise the table up, do the stretches in between the sessions.
Yep.
I'll see you next week a couple times, okay?
Yep.
Hey, thanks for watching.